Hi guys, so today I'll briefly explain how to study the subject medicine. Not whole of the medicines, not anatomy, physiology, biochemistry, etc. Just the subject medicine. So in my country we have medicine in the final year. I don't know how it is in other countries, but it is a subject and I'll explain to you how you can study medicine in a more efficient way. There are few points to follow and few things to remember. So let's get into it. Okay. So, how to study medicine? The most important thing is you should not cram medicine. Medicine is a conceptual study. People say that you have to memorize signs and symptoms and investigations, but if you do that, you'll mix things up and it will affect the care of the patient, it will affect your grades, it will affect your reputation. So, you should never cram medicine. Instead, you should know the pathophysiology, the course of the disease. You should know the causes of the disease. You should know the possible complication in a conceptual way, because if you study the disease by studying the anatomy and physiology of that organ system before, you would easily be able to identify the relevant investigation and the relevant complications of that disease. So I highly recommend studying anatomy and physiology of an organ system before studying its diseases. Always study anatomy and physiology of an organ system before studying its diseases. The second thing to do is always follow your doctor, your teacher in ward rounds. You should observe them treating a patient. You should ask questions. You should learn from your teachers, because you'll get most out of it during those ward rounds, during observing your teachers, than from the book. The third point is case cases. So what do I mean by this? Read, explore one or two cases each day that have been completed, that have been discharged. Read their files if you can, if they are available in your hospital, or if you have access to that. You should always read the history, the clinical features, investigations, and management, and at least one or two case studies will go a long way, because each case will teach you at least one disease and many differentials and many investigations. So do study at least one or two cases each day if you can. The fourth point is examine patient. By that I don't just mean examine them. Interact. Know how to talk to patients, because in medicine the first step in making a diagnosis is by talking to the patient, asking about the problem. Later comes the investigations and stuff like that. So interact with them, examine all the organ systems regularly, make a timetable. You should have a firm grip on examinations of all the organ system. So in final exam, you wouldn't be trembling before the examiner or before the patients. So regularly examine patients. The last point, but not the least, is books and making notes. By this I mean you should choose two books and you should stick to them. Why two books? One should be the main book that you would rely on, and the other should be the pocket book that you would carry into the wards or in the ER, so you would be able to read it in your spare time. So, which main books are there? The most important one that I knew of when I started my medicine, the subject medicine, were Harrison's, Oxford, Davidson, and there is a Pakistani author here named Inam Danish. So you should choose a book once and you should stick to it. It could be either recommended by your institution, your teachers, or it could be your own choice. So I chose this one, Davidson, and the pocket book I chose was Oxford Book of Clinical Medicine. But but in final year I carried my iPad with me all the time, so I didn't need a pocket book. I did have in the start, but I just used the main book since I carried my iPad all the time with me. So if you use an iPad, you don't need a second book. So let's go and open Davidson and see why it is an excellent book for studying medicine. So as I told you earlier, before studying medicine, diseases of any organ system, you should know the basic anatomy and physiology of that system, and you should also know what investigations are required or can be done in that organ system. So, as years go by in medicine, we lose touch with anatomy and physiology. So, before studying any organ system, you don't need to open Snell's for anatomy or Guyton for physiology. You can just brush up your anatomy and physiology from this book, Davidson, and in the start of every organ system, it explains the relevant anatomy and physiology relevant to diseases in a concise way. As you can see, it's only three pages, and then the investigations relevant to that organ system, so you would know what investigations can be done in the diseases regarding that organ system. So this is why I think Davidson is the book to go, because it clearly explains the initial knowledge you must have and then explains the diseases. But there is a little bit of problem in some diseases. In some modules, the signs and symptoms are just scattered in paragraphs. So for that purpose, I made my own notes, or you could just simply highlight on the book, because near exams, before exams, you can't go through whole of the book. You just need to study the relevant stuff regarding exams, because you already grasped the concept from the book. So I'll show you an example of my notes, how I made them. Let's go into that. Since it is cardiovascular system, let's go towards that. Okay, this is cardiovascular system. Let's open disease. As you can see, this is infective endocarditis. So what I did was, I took the notes or the words from Davidson, and I made them more concise, and so that it wouldn't take me too long to study them before exams. For example, in infective endocarditis, there's definition, a concise one, and then the causes, and and in causes there's also underlying conditions like rheumatic heart disease, congenital heart disease, calcified aortic valve. After that, the clinical features including signs and symptoms in different forms of endocarditis, in subacute endocarditis, in acute endocarditis, in post-op endocarditis. So some of the text from the book was copied as it is into my notes, because first of all, in this app I can do that easily, and I have explained it in a previous video, because I did it because it was more concise. Now then, investigations, I explained investigations in a brief, concise way. As you can see, blood culture, echo, blood CP, serum CRP, urine or ECG. Then management, in management again in a brief, concise way. If you open Davidson, either you have to highlight or you have to take notes, because it is explained in a great detail, and before exams you can't go through that detail. So this is how I made my notes. So let's revise or repeat those 5 points about studying medicine. Okay, here they are. So the most important point I told you is, do not cram, study it conceptually. Then the second point is, you should follow your teachers during ward rounds. Listen to the discussions. Do ask questions. Don't be shy. This is your last chance of asking questions, because when you become doctors, you can't ask questions that easily. When you're students, they treat you like students, but when you are doctors, you're their colleagues. Examine patients. You should have a firm grasp because of examining patient, because just by examining you can rule out certain differentials, and even maybe confirm your diagnosis. Study cases at least one or two a day, sticking to two books and making notes. But if you carry an iPad, you don't need two books because you can just simply refer to the main book. And for examining patient, I recommend this is the book that I used. I think it's called McLeod's. It's a really good book for learning examinations of the patients. So, guys, if you have any questions or if you want to suggest me something, do please do that.